As a new nurse, you need to understand diagnostic tests. You need to understand what they are and how do they affect your daily care with your patients. So every diagnostic test is ordered to answer a clinical question, but we as nurses are the ones that connect the dots. These tests help the providers understand what's happening inside the body, but we don't use them in isolation. So there are three main diagnostic tests: laboratory tests, your labs, blood work, imaging, and monitoring. So our labs are like what's happening at the cellular and chemical level. These are like CBC or blood count, electrolytes or CMP, BMP, infection markers like blood cultures or organ functions, creatinine, um, BUN, BNP, things of that nature, troponin. The imaging test would be MRI, CT, X ray, EEGs, ultrasounds, and these allow us to visualize structures inside the body, such as bones, organs, soft tissues, or even like the blood vessels, right, with CTs and strokes. Now, then we have monitoring tests, which track the real time body function, like heart rhythm, oxygen saturation, blood pressure, or neural status. So these are things like our vital signs, different screenings that we do, like maybe like CAM, ICU, RAS score. These are things that we use to diagnose the patient's condition and then plan our care. So for us as nurses, diagnostic tools are not just tests, they are actually answers. We're going to look at the trends, correlate the results with the symptoms that we're seeing, assess the patient, and then escalate our concerns to the provider when the results so match the clinical picture. So a normal test doesn't always mean that the patient is stable, but an abnormal result always doesn't mean an emergency. Your clinical judgment is going to matter. Diagnosis comes from patterns, and nursing turns data into decisions. As a new nurse, it's important to understand what the difference is between a CT and an MRI test. In nursing school, they glanced over it, but do you really understand what the difference is? So, a CT is like a more faster test where MRI is more detailed. A CT scan uses x rays to take quick pictures of the inside of the body. It's best for emergencies like trauma, strokes, internal bleeding, and chest pain because it gives answers fast. I feel like in nursing school, they don't talk about diagnostic tests, so let's break it down. Now, we already went over CT scans. Let's talk about MRIs. Okay, so the MRI is not about speed, it's about fine detail. The MRI uses magnets, not radiation. It takes very detailed pictures of the inside of your body, is especially good at looking at the soft tissues like the brain, the spine, ligaments, your joints, nerves. So MRIs actually take longer than CTs. So CTs can take like up to like 10, 20 minutes, whereas MRIs is 30 to an hour. And this is because the machine is capturing each detail layer by layer. This is why the patient has to lay so still. So even as a nurse, you have to ask your patient, are they claustrophobic or do they have anxiety? And you'll ask the provider to give you an order for possibly Ativan or something to help them relax so they can stay still and the test can be completed. So during the test, it may feel loud and tight, and you have to warn the patient as well beforehand. Now, before MRI, the nurse is also going to screen for metal, implants, pacemakers, and shrapnel because magnets and metal do not mix. The MRI has a big magnet and it will cause either the patient or things of metal to slam into the magnet. Also, with the MRI, sometimes contrast can be used. So, you're going to check the kidney function, the BUN, the creatinine, and urine output to make sure that they can tolerate contrast and also ask if they're allergic to contrast, iodine, or shellfish. So, all in all, MRIs do not rush, they take a little bit longer and it reveals fine details versus the CT looks at the big picture and it's very quick and fast for emergencies. In nursing school, they move over diagnostic tests so fast. So let's talk about x rays. X ray is usually the first imaging test that's even ordered, and this is why. The x ray uses a small amount of radiation to take quick pictures of the body. This is best for looking at bones, lungs, and basic structures. Right? If you break your leg, x ray. If you hit your arm, x ray. X-rays are commonly ordered for fractures, pneumonia, bowel obstruction, and checking tube or line placement. For example, if you place an NG tube, OG tube, or even intubation, you're going to order an x-ray to make sure that these lines are in the places that they should be before you actually use them. Before x-ray is provided, the nurses need to take in consideration a few things. Is the patient pregnant? Help with proper positioning, because positioning actually affects the image quality. Now, for x-rays, it's very little prep, and most x-rays are done at the bedside, but reviewing the results quickly can help determine better care, especially if something acute shows up. X-rays are fast and effective, but they have their limits. For more tips like this that every new nurse deserves to have, but often has to find out on the job training, go ahead and get the New Nurse Fast Track Guide. The link is in my bio. In nursing school, they go over a diagnostic test way too quickly. So let's talk about ultrasounds. Now, ultrasounds, they can be used to visualize a lot of different body parts, and it gives answers in real time without radiation. The ultrasound uses sound waves to create images of organs, blood flow, and fluid inside the body. So it's commonly used for pregnancy, gallbladder issues, kidneys, bladders, blood clots. So in cardiac nursing, we know ultrasounds are considered echoes or called echoes, and they visualize the heart, the chambers of the heart, the blood flow, and we determine the ejection fraction. Ultrasounds, of course, are used for pregnancy to determine the size of the fetus and how far along you are in the progress. Because ultrasound has live imaging, providers can see movement as it happens. Ultrasounds are very safe, even during pregnancy, obviously. Now, for some ultrasounds, if you're assessing the pelvic and bladder, you're going to have your bladder full for better visualization. So patients are asked to drink water and not to void before the ultrasound. Now, other ultrasounds of different areas may require the patient to be NPO, just depending on what is being examined. So you have to keep that in mind when you see an ultrasound ordered. Now, gel and pressure may be uncomfortable, but patients really shouldn't have pain during ultrasound. And position may matter based on the type of ultrasound and for image quality. The ultrasound is safe and it's real time and is highly dependent on preparation. For more new nurse tips like this, go ahead and check the link out in my bio for the New Nurse Fast Track. I don't believe nurses should learn on the job. I believe that we should be orientated to be safe nurses. And so that's why I did something about it. New Nurse Fast Track, get yours today. In nursing school, they don't talk about diagnostic tests enough for me. So let's talk about an echo. An echocardiogram are ultrasounds, but not ultrasounds are echoes. So an echocardiogram, or an echo as we call it, is a type of ultrasound that looks at the heart. It can be invasive or non-invasive, but it will look at the heart as far as the chambers, the blood flow, and the function of the heart. So what we call the actual overall function of the heart is the ejection fraction of how much blood is able to be circulated throughout the body by the heart. Check. It uses sound waves to show how the heart is moving and pumping in real time. So echoes are ordered to check heart size and chambers, the heart valves, how well the heart pumps, which we consider to be ejection fraction, the blood flow throughout the heart, and the causes of shortness of breath, chest pain, or heart failure, which we could look at like fluid or blood or lack of blood volume or everything in between. Now for a standard echo, it's going to be non-invasive and it's little to no prep for the patient. Nurses can help with positioning and monitoring vitals, but generally you're going to have them in a semi-Fowler's position, and the provider will do an echo at the bedside, or they may go into the certain imaging area. Now for TEE, which is actually invasive, and it is a form of an echo, there's a probe that's inserted down the throat. And of course, your throat is numbed before. The patient has to be NPO for at least 4 hours before, and they may receive sedation to actually complete the test. Now, during the procedure, nurses may monitor airway, vitals, and your recovery closely. Now, echo doesn't just show the heart, it shows how well the job is being done. So we'll go over the difference between a TEE and a TEE. We'll go over the difference of a TTE and a TEE in the next video. Now, if during this video you were saying to yourself, you need more new nurse tips like this, well, go ahead and go to my bio. I created the New Nurse Fast Track Guide just for you. It's now available in PDF. We go over everything a new nurse is going to cover and be exposed to in their first year. Get yours today. Nursing school goes over diagnostic tests way too quickly. Let's go over heart ultrasounds. So, two forms, it's the TTE and the TEE. These are the same tests, but two different ways to even look at the heart. The TTE is a transthoracic echo. This is an ultrasound that is done on the outside of the chest, so it's non-invasive. A TEE is the transesophageal echo. This is an ultrasound that is done through the throat. So a probe has to be placed down your throat. The patient is sedated and numbed for this test to be performed, and they have to be kept in PO at least 4 hours prior to for the probe to go down into the esophagus. Now, a TTE is generally the first choice, right? Because it's non-invasive, it's quick, and it's comfortable for the patient. Now, the TEE is more invasive, and this is generally used when the provider will need clearer images, more detailed, and more. Now, for the TEE, this is when this is when providers need a more detailed image of the heart valves, clots, or infections. For TTE, that's the non-invasive echocardiogram, there's no special prep for the patient. There's basic positioning, generally semi-Fowler's or low Fowler's position, and the nurse can help with positioning and comfort. Now, the TEE requires the patient to be NPO for at least 4 hours prior to the procedure. They have to have sedation and a numbing agent for their throat. The nurse will monitor the airway, vital signs, and recovery during and after the procedure. A TTE looks at the heart from the outside, whereas the TEE looks at the heart up close. Now, for more new nurse tips like this, go ahead and click the link in my bio. I made the New Nurse Fast Track Guide just for nurses like you. I feel like nurses shouldn't have to learn on the job. We should be oriented properly, safely, and competently. So get your New Nurse Fast Track Guide. This covers everything a new nurse will be exposed to and have to learn within their first year of nursing.